We'll discuss about the stomach. Now look at this organ. When you see this organ, this is the organ which is situated in the abdominal cavity. This is the stomach we are observing. During the practical, generally what we ask, the first is the identification of the organ, that is the stomach, that you have to identify. What are the gross anatomy of the stomach? That we are going to see now. The gross anatomy of the stomach. Gross anatomy, when you see the stomach, there are two openings you are observing. This is the one opening you are observing. This is an opening of the esophagus. So esophagus will open. This is the esophagus will open at the cardiac part of the stomach. This is the cardiac part of the stomach where esophagus will open. So esophagus will open. It means this is the esophageal opening which open into the cardiac orifice, which at the level of T10. Now the second opening which we are observing, this is the second opening, this is the pyloric opening. This pyloric opening which is situated at the level of L1. So it means I can say stomach is situated between the T10 and the L1 vertebral level. The second question, when you see the stomach, how to hold it in anatomical position. So if I observe, this is the esophagus opening and this is the pyloric opening. How to identify which is the esophagus and which is the pyloric opening? Now, if you palpate this and this is the esophagus and this is the pyloric opening. How I will identify this? Because pyloric opening, it is more muscular because it has anatomical sphincter, whereas esophageal opening is having the physiological sphincter. So it is not that much thick, because when food particle come onto this opening, then only this used to be open, otherwise it will be closed. But this pyloric sphincter will be open all 24 hours because it has anatomical sphincter. It is very thick. It is, when you palpate it, it is very thick musculature it has having. So this is the pyloric sphincter and this is the cardiac orifice. The second, when you see between the esophageal opening and the pyloric opening, you are observing this curvature. This is the lesser curvature. This is a small curvature. When you observe from esophageal opening to this side, the greater curvature, this is the greater one. This is the greater curvature and this is the lesser curvature. So now I have identified the two openings, esophageal opening and the pyloric opening. I have identified this is the lesser curvature and the greater curvature. Now stomach, as we know, this is shifted, or this is towards onto the left side. So lesser curvature will face towards the right side, whereas greater curvature is onto the left side. So this is how we identify. This is the anatomy. This is what the esophageal opening. This is the pyloric opening, and this is the lesser curvature and the greater opening. How will you hold it in anatomical position? This esophageal opening, it is lateral to the midline. It is lateral to the midline. Keep it in mind. See, suppose this is the midline of the abdominal cavity. This is the midline of the abdominal cavity. Esophageal opening, it is shifted left to the midline, whereas pyloric opening, it is shifted right to the midline. This is almost lateral to the midline, towards the right side, and this is towards the left side. And this is how we hold it in anatomical position. This is the anatomical position of the stomach. So lesser curvature will face towards the right side, greater curvature will face towards the left side. Now come to the parts of the stomach. When you look at the stomach, there are four parts of the stomach where we have an opening of the esophagus. So this area is called as cardiac part. Now look at this. Just lateral to the esophagus, between the stomach and the esophagus, this notch which you are observing, this notch is called as cardiac notch, because this is the cardiac part. So this is the cardiac notch. When you take an imaginary line from the cardiac notch to the greater curvature, now above to this, whatever part you are observing, this is the fundus of the stomach. This is the fundus of the stomach which is above this imaginary line. Second imaginary line will draw or will plane from the incisura angularis. This is the incisura angularis. When you look at this onto the lesser curvature, you are observing this angle. This is called as incisura angularis. So from the incisura angularis, and you place an imaginary line, you draw an imaginary line towards the greater curvature. This is a second imaginary line. So between the first imaginary line or second imaginary line, whatever part you are observing, this is the body of the stomach. So we have seen this is the fundus of the stomach, this is body of the stomach, and this is the cardiac part of the stomach. And below to this incisura angularis or this imaginary line, whatever part you are observing, which is about 10 centimeter long, this is the pyloric part. So this is the pyloric part. This lowermost is the pyloric part, which is again divided into two, pyloric antrum and pyloric canal. So this is how the 10 centimeter long, this is the pyloric part which continues as a duodenum, the first part of the duodenum. So these are the 4 parts of the stomach. So we have to identify the 4 parts of the stomach. First imaginary line from the cardiac notch. So this is the fundus, this is body. Then from the incisura angularis, the second imaginary line. Below to this we have a pyloric part of the stomach. Now next question which generally used to be asked, that is what the ligaments of the stomach, that we have to keep it in mind. So come to the ligament of the stomach. If you see stomach is, and it is intraperitoneal structure because it is inside the peritoneum. If you observe this side, we have lesser curvature. Onto the lesser curvature, whatever you are seeing this is the lesser omentum, which is between the lesser curvature of the stomach and the liver, because this side we have the stomach. So between the stomach and the lesser curvature of the stomach, liver and the lesser curvature of the stomach, there is a peritoneal fold, that is called as lesser omentum. When you look at the greater curvature, from the greater curvature, the जो part आप देख रहे हैं peritoneum का, this is what the greater omentum. So from the greater curvature, the greater omentum is suspending downward into the greater sac itself. So that is the greater omentum. This is the greater omentum part, and this is the lesser omentum. So lesser omentum, it is connected between the liver and the stomach as well as the first part of the duodenum. This is the lesser omentum. When I talk about the lesser omentum, it has 2 attachments, one onto the lesser curvature of the stomach, another one onto the liver. What are the contents of the lesser omentum? Lesser omentum, the part towards the stomach which you are observing, this consisting the artery. See, here you are observing these arteries. These are the left gastric artery and the left gastric vein, and this side we have a right gastric artery and the right gastric vein. So I can say the left gastric and the right gastric vessels, these are the contents of the lesser omentum towards the stomach. So these are, see there you can see this is an artery and the lesser omentum itself, and this is the vein you are observing. So these are the gastric arteries and the gastric vein. Towards the liver, the lesser omentum part is having the free margin where we have 3 important structures: hepatic artery, portal vein and the bile duct. Come to the greater omentum. This greater omentum will consist the blood vessels which are running onto the greater curvature. So onto the greater curvature, we have right and the left gastroepiploic arteries which are running onto the greater omentum. And another content of the greater omentum is, another content are the fat, lymphatics. These are that's what it is called as policeman of the abdomen, because it has a huge amount of the lymphocytes or the lymphatics. So this is about the 2 ligaments which we have seen, the lesser omentum and the greater omentum. Another ligament, when you look at the cardiac notch or the cardiac part, the posterior side we have a ligament which comes onto the diaphragm and the stomach. That is called as gastrophrenic ligament. So gastrophrenic ligament is onto the posterior part of cardiac orifice and the diaphragm. So that is the gastrophrenic ligament. And from the fundus, the posterior part of the fundus, there is one more ligament which goes toward this organ. This side we have a spleen. So between the stomach and the spleen, there is one more ligament you will have, that is called as gastrosplenic ligament. So there are mainly 4 ligaments. You have to keep it in mind. One is the lesser omentum, greater omentum. From the cardiac orifice posteriorly, we have a gastrophrenic ligament, and from the fundus part toward the spleen, there is one more ligament that is called as gastrosplenic ligament. So these are the 4 ligaments generally we'll discuss in the stomach. So these are the parts and the anatomical position that we have seen. Now when I cut open the stomach, now look at this. When I cut the stomach from the greater curvature, you will see the rugae. These are the rugae you are observing. See, there are foldings you are observing. These are the foldings you are observing. These are the mucosal foldings you are seeing. These mucosal foldings which you are observing inside these are the temporary foldings, because when food particle comes inside the stomach, when the stomach is distended, these foldings will be disappear. So these foldings are called as rugae. These are the mucosal foldings. Some mucosa is not there, that's what they are not permanent, they are temporary. And when you look at the lesser curvature towards the lesser curvature, see this is the greater curvature. When I go towards the lesser curvature, you are seeing the longitudinally folds. See, these are the longitudinal folds you are observing, and between these longitudinal folds, there are gastric canals you are observing. See, this is the longitudinal canal you are observing. This is a gastric canal. क्यों बने gastric canal towards the lesser curvature? क्योंकि food particle सबसे पहले hit करता है gastric canal पे. जैसे ही food particle आया through the cardiac orifice, this food particle come and hit onto the lesser curvature itself. That's what lesser curvature. It is more prone for the gastric ulcers, because the lesser curvature is having the more nerve supply. The food particle hit onto this area, so more SCL secretions or the acid secretion onto the lesser curvature itself. So this is the gastric canal you are observing. When you go down into the pyloric part, there is a sulcus terminalis. in the sulcus intermedius, sulcus intermedius. Sulcus intermedius se upar wala part is called as pyloric part, and below to that we have a pyloric canal. Above to the pyloric antrum, and below to that we have a pyloric canal. So between them we have a sulcus intermedius. This is a sulcus intermedius, and this lesser curvature you have observed. This is the incisura angularis, which is onto the lesser curvature. This is the fundus part. This is the body. This is the pyloric part you are observing, and this is the cardiac part. So we have discussed about the ligaments. Now come to the blood supply. If you observe the stomach blood supply, left gastric artery and the right gastric artery runs onto the lesser curvature, which anastomose with each other and supplies to this lesser curvature wala part of the body of the stomach. When I come towards the greater curvature, it is being supplied by the left gastroepiploic and the right gastroepiploic branches. And when I come to the fundus, this is the fundus, fundus is being supplied by short gastric arteries, which are the branches of splenic artery. So this is supplied by the short gastric artery. And one more important thing, during what happened generally when we discuss about the nerve supply, we say there is an anterior vagal trunk and the posterior vagal trunk. Anterior vagal trunk is onto the anterior side and posterior vagal trunk is onto the posterior side. How the right and the left becomes the anterior vagal trunk? Because during the development, this stomach is situated, during the development, the dilated part of the foregut is situated like this. So this side we have a right vagus and this side we have a left vagus. This is the right surface and this is the left surface. Now what happened? There is a 90-degree rotation. There is a 90-degree anti-clockwise rotation in the foregut. 90-degree anti-clockwise rotation. Because of this, what happened? The lesser curvature comes onto the right side. So now what happened? The right vagus become the posterior vagal trunk, and the left vagus become the left vagus become the anterior vagal trunk, and this is the anterior surface, and greater curvature comes onto the left side. So this is how it rotates the stomach. Now relation, when I talk about the posterior relation, stomach bed, what are the structures which are forming the posteriorly onto the stomach bed? Posteriorly we have a diaphragm. Superior side, along with the diaphragm, we have a 3S. These are the splenic artery, splenic flexure, and suprarenal gland. Mostly the left suprarenal gland. Then we have a left kidney. We have a left transverse. We have a transverse mesocolon, and we have a pancreas. These are the structures. And even keep it in mind, the lesser sac is situated behind the stomach, whereas greater sac is situated in front to the stomach. Anterior part of the stomach, when you see. Now look at this anterior part of the stomach. When I say this, what are the relations? There is a triangle onto this. See, this is this side, the left side, we have a left costal margin which are overlapping this. These are the left costal margin, and this side the liver comes. So between the liver, right side, the left costal margin, and below to that we have a transverse colon. So this area is called as gastric triangle. So what are the boundaries of the gastric triangle? This side we have a liver, right side, left side we have a left costal margin, and below we have a transverse colon. So this area of the body, which anteriorly, this is called as gastric triangle. This gastric triangle has an important role when esophagus is not working, peristaltic movement is not there. So what happened in that case? The directly food through the rice tube, you can go through the anterior abdominal wall. There is no organ because it is not connected with any organ, it is not related with any organ, this gastric triangle, and that directly pipe you can insert into the stomach. So food, it can enter into the person's body or the patient's body. So this is how the anterior relation, that is very important, and the posterior relations are very important in the blood supply that we have seen. So this is about the whole stomach. So you again just quickly will see, this is the esophagus opening, this is the cardiac opening, this is the cardiac area, this is the fundus. There are two major lines from the cardiac notch to the greater curvature. This is the body. The second from the incisura angularis. This is the incisura angularis. This is the pyloric antrum, and this is the pyloric canal. दोनों के बीच में there is a sulcus, that is the sulcus intermedius, and this is the lesser omentum you are observing. This is the greater omentum you are observing, and inside you have seen these are the rugae, and towards the lesser curvature these are the gastric canal. So this is about the whole stomach that we have seen. So whole stomach, anatomical position, and these parts that we must learn about the stomach. Thank you.